Carotid artery disease is the buildup of cholesterol and plaque within the carotid artery, which is the artery that exits the heart and delivers blood flow to the brain. One of the gold standards of the treatment options is a carotid endarterectomy, and this is where we create an incision in the neck. We actually open the blood vessel or the carotid artery, and we take out the cholesterol and plaque, and we put a patch on top so that the vessel stays wide open. As with any surgery, there are risks, and there is a risk of stroke during this surgery. The rates of stroke during a carotid endarterectomy ranges, I'd say from anywhere from 1 to about 3 to 5%. There has been several advancements. Traditionally, we were doing what we call transfemoral carotid stents. We actually put a small catheter in the blood vessel in the groin, and we would guide catheters and wires all the way up to the aorta, go into the carotid artery, and open a stent, which is like a metal cage that keeps that plaque up against the wall. There's been even newer technologies called TCAR, or Transcarotid artery revascularization. And this combines the best of both worlds. And so what it is we create a small incision at the base of the neck to the common carotid artery. So that way, we're not tracking catheters and wires through the entire aorta, which has the risk of breaking off pieces of cholesterol and plaque. We're simply accessing the artery, and it's about this far, about 5 centimeters from where we deploy the stent. So having that close proximity to where we place a stent gives an advantage in preventing any perioperative stroke. This is the picture we took to plan our stenting. We have the internal carotid here, and you can see there's a very tight lesion here. What also is an advantage of this procedure is that to protect the brain from stroke during the procedure, we do something called reversal of flow. And what that means is that we actually have blood reversing flow out of the body. We filter the particulate and go back into the vein in the lower leg. And so there's almost minimal, almost zero risk of any of that clot breaking off because blood is not flowing forward. The next thing we do is you see that balloon, that was the second stent being unsheathed. And so I unsheath it and it opens up. And we do this under reversal of flow. Right. Because this is one of the most challenging parts, is if that wire touches any of that cholesterol plaque or whatever's there, it can go antegrade. But because we have reversal of flow, we caught it in that filter that you all saw.
This is what it all caught.
Oh, wow. Yeah. So choosing between carotid endarterectomy and TCAR is a very good question. Carotid endarterectomy is still the gold standard of surgery and still the safest way to perform a surgery in anyone who has carotid disease. What the TCAR does is it opens other options to our very high-risk patients. People who have heart disease, people who had a recent heart attack, people who have disease on both sides, people with uncontrolled diabetes or bad lung disease. And so TCAR right now is reserved for those types of patients. As well, TCAR does take underlying resources to be able to do. This is a pretty advanced technology. And here at Methodist, we have all that we need to bring this new technology to our patients.